Hi, and welcome to Tish Talks. And I'm Tish Holmes, Program Director with Alzheimer's and Dementia Services of Northern Indiana, a division of Real Services, where our motto is helping people right here, right now. And we're going to continue our discussion about hospice today. We said that hospice can be a little bit challenging if we don't understand it. And I've got someone here to help me today. We've got Travis Parmalee of Comfort One Hospice to help us explain it a little bit. Hi, Travis.
Hi, Tish.
Well, thanks for coming.
Glad to be here. Thanks for having me.
So I do want to just jump right in and ask you about advanced directives. We hear about advanced directives when you go into a hospital or a doctor's office. The first thing they ask you are, what are your advanced directives? And for hospice, we need to know that as well.
It's not a requirement, but it is certainly an encouragement. It is a big part of the program is talking about what your decisions are at the time getting close to death. And of course, when hospice comes in, we're dealing with that time in life.
Okay, and so advanced directives, is that the same as a DNR, which stands for?
That's a good question. DNR is not the Department of Natural Resources, but do not resuscitate.
Thank you.
Depending on who you're talking to, you may confuse some people, but that's a great question. People are always confused about that. Advanced directives takes in all of it. DNR being a part of it. There's another form now called a POST, a physician's order for scope of treatment. It's a little more detailed than the DNR. DNR is simply do not resuscitate, CPR, intubation. So if one of those is signed for somebody, it doesn't mean emergency crews won't do anything. They just will not do chest compressions or intubation because they're likely to cause more damage than good. They're still going to do everything else to try and revive the patient.
Okay, thank you very much. Thank you. And so a person, you can, with hospice services, can you have a DNR or can you not have one? Can you still have to perform CPR?
Yeah, you can still be a full code, which is when you want everything done possible if you're found non-responsive. It's a personal and family choice, and I don't think that it's right of any organization or government to force that on a family, and I believe that they believe the same way. So no, it's not a requirement. It is something that we encourage because the damage to a frail elderly person when chest compressions start can really break ribs, do a lot more damage than it will do good. But it's also something that we don't talk about all the time, so when this conversation does happen, we tend to get into a little more detail, a little more emotion, and it becomes a family conversation at that point. So it doesn't happen immediately for some folks. Some folks, like I could tell you right now, don't pump my chest, let me go. There's different reasons for that. So it's a very individual and family decision that they should be able to make on their own time.
Wonderful. Thank you. Well, thanks for sharing about that and why it's important. And why is it important to contact hospice earlier rather than later? I know one of the misconceptions about hospice is if a person, people think that they have 3 days left and then we call hospice, but that's not so, is it?
That's not so. It initially, when hospice was in its very early years, was meant to be comfort care for those that are in their last week of life and there's nothing we can do, let's just keep them comfortable. Of course, it's evolved a lot since then because there's a lot more involved than just that patient and their comfort. There's family involved. There's a lot more to it. The reason we encourage folks to think about it sooner is one, advanced directives. If a person with dementia gets to a point to where one day they can make their own decisions and the next day they can't, you don't know what day that is. So to be prepared for that ahead of time, again, along the lines of the advanced directives, that's important. Hospice can get involved and help with that stuff and have those conversations and get to know the family, the family gets to know the hospice team, the chaplain, the bereavement coordinator, nurses. If they know those folks a longer period of time, when that loved one does pass away, the bereavement can be that much more effective because now we're almost a part of their family. If we've only known that family for a couple of weeks or a couple of days, it's likely that our bereavement, although we're still going to extend it, it may not be as effective. And the quality of the service becomes much better as the two parties get to trusting each other more and more as that relationship builds through hospice and patient.
Absolutely. I like that. Good philosophy behind that. So how does a person know if they're eligible? I know you mentioned, because we deal with Alzheimer's and dementia, however, you don't just have to have Alzheimer's or dementia for that. Some folks think it's only for cancer.
Yeah, and it's not. It's for any life-limiting illness.
Okay.
There is a Medicare guideline that there has to be a prognosis of 6 months or less
Okay.
with a diagnosis that there's obviously no cure for. The prognosis is a little tricky because life expectancy is not an exact science.
Exactly.
Doctors do the best that they can. Ultimately, I think what it boils down to is if you've got a life-limiting illness and you're teetering on whether you want to pursue treatment or not,
Mhm.
it never hurts to talk to a hospice agency. If they think the disease is going to run its normal course,
Mhm.
then yeah, you may pass in 6 months or less. That's what the doctor has to agree to. But other than that, the doctor has no idea what normal is or a
Okay.
normal course is, because we're all so different. So I would say that any diseases like diabetes, COPD, cancer, congestive heart failure, those are all at a certain point. Maybe you're not a candidate for surgery or any type of treatment anymore, and all you can do is manage the symptoms of that. That's a good time to call hospice.
Mhm.
Everybody's a little bit different when it comes to eligibility
Okay.
because everybody's medical records are all completely different. So it's hard to put a hard line on eligibility when every patient is so different. But there does have to be a 6 month or less prognosis and a life-limiting diagnosis.
Okay. And if someone does make it their 6 months with your care, and do you reevaluate? Are they just dismissed off?
That's
What
a
happens?
great question because we run into that and folks think that, if it's 6 months or less prognosis, then they only get 6 months of the benefit.
Mhm.
Not true at all. My own grandmother was on hospice for 3 years.
Mm.
Alzheimer's and dementia are one of the ones that's trickier to prognosticate life expectancy. She could have maybe done it. She could have passed away in a year. She passed away in 3, but she was declining the whole time.
Okay.
So yes, it's about recertifying and reevaluating every 90 days to make sure that their patient is still declining and that they're still eligible for the benefit.
Okay, all right. Well, thank you so much for helping to dispel some myths that may be out there and to clear up some misconceptions and just give us some good information about hospice services as a whole. We certainly appreciate having you, Travis Parmalee of Comfort One Hospice, here to help us with this conversation.
Thank you.
Thanks for being here, and thank you, caregivers, for being here.